Thank you, everybody, and thank you to the Health Secretary for being here and her entire team. Thank you to the mental health support workers and the clinicians that we have at this pop-up service. What I said from the very beginning, and I know Susan Pearce as the Secretary focused on this from the beginning with Susan Hyman, the Acting CEO of the Health District, focusing on making sure that there are mental health services embedded into the community. We are going to need these in place for a while. We know that with trauma like this, it's often in the weeks and months ahead, not necessarily the days, where people need the most support. So I wanted to take an opportunity while I was in the region to thank the staff that are providing these services, to thank people like Matthew and Stu who are directly providing mental health work and support and care to people who are coming in. People are coming in for a variety of different reasons, and they will over the days and weeks ahead. And what we've got to do is make sure that when the cameras go, when the lights and sirens stop, the support remains in the community, and that's very, very important to me personally, and I know it's very, very important to the Secretary. We also had an opportunity earlier to thank our frontline paramedics, our first responders, have a chat with those brave women and men who were on the scene at that night, or who dispatched from our control centres, or were following cars and trucks in crews that landed or were situated thereafter, or was directing multiple helicopters to land in the middle of the night in foggy conditions, in very cold conditions and under very trying circumstances. This was a scene the likes that none of them had ever experienced, and yes, they are highly trained, yes, they are incredibly professional, yes, they practice for these scenarios, but they are still human beings, and I wanted to make sure, as did the Premier, to let them know on behalf of the entire state how proud we are of them, how much they're in our thoughts at the moment, but also for them to take care and look after themselves. We met with and had a discussion with the Commissioner of Ambulance, Dominic there as well, and we've been in discussion through Susan and myself with Dom multiple times over the last few days, and it's just been about focused what we do for the staff who are situated, who have been through these very, very difficult circumstances. Susan had an opportunity to speak with some of the frontline health and medical and nursing staff and allied healthcare professionals who are looking after our patients right across the board. Those people in the hospital that night did a phenomenal job, an incredible job dealing with injuries that were catastrophic. And can I say how proud I am to be their minister. Every single person in the health service has performed incredibly, as have all our emergency responders. But as the health minister, particularly want to thank our frontline paramedics, our call centre controllers, our frontline nurses, our allied healthcare workers, our doctors, our emergency department staff, everyone who did an incredible job to make sure that those who were injured were cared for and looked after and supported. And I know that on behalf of the entire state, we are sending our thoughts to those in our hospitals at the moment who are better, stable, as they say, but still a rough road ahead.
What is it like speaking to some of those first responders? What do they tell you about that night? How do you feel, I suppose, as the Minister, having spoken to them about that?
Well, as their Minister, I'm really proud of them, and that's what I said to each of them. What I'm amazed in health about is that the care health professionals have for everyone else, and often not themselves. Immediately on that Monday evening, I spoke to one of the paramedics, Luke, and he talked to me at the end of it, the conversation. He said, I'm even now, Ryan, thinking about what we may have done better or could have done differently. This is a person who performed what I think are miracles on that night, to be able to navigate, direct, organise a scene, to be able to triage patients, to be able to get helicopters to land a few kilometres down the road, to be able to organise for police to pick up blood products from the John and move it down. It's phenomenal, unbelievable work, and I'm really proud of them, and I can't do or say much to them other than how proud I am and I know I speak on behalf of the entire government and of course the Premier, who has been up here as well. We're really, really proud of them, proud of the community leaders as well. Jay and Sue have done a fantastic and phenomenal job, as have our local members in Clayton and Dave Lizelle. Really, really positive. And in the darkest of times, we see the very, very best in human beings.
So my understanding is there's still, I think, 5 Victorians who are in hospital in the Hunter. Have you had any contact from your counterpart from Victoria or any message support from them?
Yeah, not yet. My focus is just trying to be on the response at the moment. I'll make contact with them over the next day or so to let them know that they're being cared for. We have a fantastic health system in New South Wales. We've got great people in it. They're going to be cared for and looked after. But this is a national tragedy, and a tragedy that has touched so many people. And as is often the case in weddings, people come from near and far to celebrate the love of a couple. And what should have been a beautiful, happy, memorable day full of love and joy has turned into a catastrophic event, the likes that our country hasn't seen for 3 decades. And it's going to take a long time for many, many people in this community and the surrounding region, but also those who have been affected interstate to get over it.
Can you quantify any additional mental health services or other services that will be provided to the community?
Yeah, we'll make sure that what this community needs, they get. We've made it very clear, as has Susan, that our focus is on making sure that we are there built in the community for as long as they need to be. And I'm in constant contact with the local members of Parliament, the local mayors, and I've made it very clear to them that if they feel that there needs to be additional support, they'll let me know. Susan has made that clear to the local health district. We've got to work together as a system to support the community, and sometimes that support will look differently in the weeks and months ahead. But I give them the commitment as the Health Minister that will be there every step of the way as they start to hopefully recover.
Minister, it's sometimes with towns like ours here in Singleton, people will put on a brave face and try to move through it without seeking the help that they may truly need. What would be your messages to those people who might be just putting kind of a shield be right approach to put that strength through to their family?
Look, please speak up. Please talk. Please don't think you have to carry this burden on your own. Your reaction may be very similar to someone else or how someone else is feeling, or it may be very different. You may feel something at a different point in time. Spoke to the ambulance, the paramedics down there today, and one of them said to me, the reason why I've spoken up about that I'm struggling is because I want my colleagues to feel it's okay for them to speak up, and I want the community to understand that this has affected everyone. It's affected me as the Minister. That's the reality of it. And we've got to put our hand up and say we're doing it tough, and if people are doing it tough, I want to make sure the support is built in the community at a place that is familiar with them, that they can go and have a cup of coffee and have a chat. That's maybe all they need, or they may need a bit more support. But that first conversation, I know it can often be the hardest, but it's probably the most important, and I don't want people to think they have to carry that burden on their own.
How did you feel visiting them this morning?
It's one of the most difficult things I've done. It's very, very tough to see a scene that was a scene where so many people lost their life. That has been a national disaster. How can you feel other than simply dismayed and shocked and deeply, deeply saddened? Children are without their parents. People are without their partners, loved ones are gone, friends are gone on what should have been arguably one of the most special times, special celebrations. We've seen one of the worst tragedies ever. And it's hard to fathom it, but at the same time it's my role to make sure that I'm connected with what's happening on the ground, and that's very, very important to me as the Minister. And I wanted to make sure that our community leaders understood that if they needed additional support through Susan and myself, we would be there, and I wanted to make sure that our frontline responders felt as though the government realised the level of skill and bravery and compassion and professionalism they showed. And I think that was important.
Can you provide me more detail on the nature of the injuries that people are facing in hospital?
Probably not. That's okay. Yeah, they're stable, but
Nothing life-threatening.
not at this stage. But look, things change. What I've learnt, been in and around health for a little while in different roles, and through Susan's knowledge and experience, is that things can change, and they can change rapidly. So, so far, those people have been treated really well, and they're going okay. But yeah.
Susan, could I ask you, with the Hunter Health communities last night, how they holding up now?
Yeah, obviously incredibly traumatic to lose a staff member. Had the opportunity to go to Calvary Mater today and sit down with the management team and some of the junior doctors there. And, you know, they're feeling very raw. So it will take them some time to recover. Rebecca was obviously a much loved member of the family there. So, you know, they're feeling as you would expect them to, and it was really nice to be able to spend some time with them today, along with our paramedics from this community and from others who responded. The message I heard over and over again today, both at the John Hunter, Calvary and down here with the ambulance crews, is just how the whole health system came together in a really remarkable way to deal with this dreadful incident. And so, you know, we're proud of that because it's what we do. It's just fortunate that we've had to put that capability on display in such a horrific incident.
Thanks, everybody.